and I'm going to be talking to you about neonatal abstinence syndrome, otherwise known as NAS. When a woman enters the hospital to give birth to a child, they all hope for one thing: a healthy baby. While doing previous research, I learned about NAS and the effects it can have on a newborn. As a nursing student, I someday hope to work in the neonatal intensive care unit, which is where NAS cases go. To get a better understanding of neonatal abstinence syndrome, we will cover 3 topics, which include what NAS is, what the effects of different drugs are, and treatment options for substance abuse. I will start today by explaining what neonatal abstinence syndrome is. Neonatal abstinence syndrome is a term used for newborns that are experiencing withdrawal symptoms from a drug or drugs that the mother was using while pregnant. The symptoms of NAS vary based on the type of drug used, how much was taken, how long the mother used the drug, whether the baby was full term or preterm, and how the mother's body breaks down the drug. Symptoms of NAS can begin a few hours to 3 days after birth, or it can take 5 to 10 days for them to appear. According to the National Library of Medicine, the main symptoms include blotchy skin coloring, diarrhea, excessive or high-pitched crying, excessive sucking, fever, irritability, seizures, poor feeding, sleep problems, rapid breathing, slow weight gain, trembling, and vomiting. A news article from CNN.com found that between 55 and 94% of babies exposed to opioids prior to birth exhibit signs of withdrawal. Another statistic reported by ScienceDaily.com states that by the year 2009, the estimated number of newborns with the syndrome was about 13,539, or about 1 baby born each hour. To treat the syndrome, the infant is often given morphine to help with the pain, and some babies are given a drug similar to that of which they are addicted. The dosage is then decreased over time to help wean the baby off the drug. Oftentimes, babies going through withdrawal are irritated and hard to calm. Because of this, extra care from staff is required. It has been shown that rocking and swaddling can help calm them. Now, let's get into some of the drugs a baby can become addicted to. When a woman uses drugs while pregnant, it can pass through the placenta and the baby can become addicted. Heroin is one of the most harmful drugs a woman can use while she is pregnant. According to the American Pregnancy Association, if a mother uses heroin while she is pregnant, it can increase the chances of the baby being born premature, having low birth weight, bleeding within the brain, and death of the baby. Cocaine is another drug that is dangerous to an unborn child. Withdrawal symptoms of cocaine include tremors, sleeplessness, muscle spasms, and feeding difficulties, and cocaine use can also lead to fetal death. Some other drugs a baby can become addicted to are marijuana, methamphetamines, and prescription narcotics like Vicodin. Marijuana smoking during pregnancy can cause a baby to have reduced oxygen supply, which can lead to miscarriage or premature birth. Also, the effects of methamphetamines used during pregnancy are similar to those of cocaine use. Although the effects can be devastating, screening and treatment options are available. Universal screening is the preferred method of screening for substance abuse. This includes the process of interview, self-report, and clinical observation. In the guidelines for screening, which was released by the University of Vermont, it states that it may be useful to use urine toxicology as a follow-up to a positive interview screen. Urine toxicology can confirm the presence of a drug, determine if there is more than one drug being used, and determine if a newborn is at risk of withdrawal. If the interview screen and urine toxicology are both positive, a physician may recommend treatment. Treatment for substance abuse in pregnant women should be done under medical supervision. As found in an article from the Journal of Obstetrics and Gynecology International, attempting to detox at a rapid pace while pregnant can cause poor fetal growth, preterm delivery, and fetal death. One way a woman is treated is with the use of methadone. Methadone treatment for pregnant women began in the 1970s and is still the recommended medication for opioid addiction. Although some are skeptical of the effects of methadone on babies, studies have shown that methadone-exposed children fall within the normal range of development. Another drug that may be used to treat substance abuse is buprenorphine. The availability of buprenorphine through office-based treatment rather than opioid treatment programs may make it easier for women to receive medication treatment. There has not been much testing done for buprenorphine, and it has not been approved by the FDA as the main treatment of opioid addiction during pregnancy, but it could become one. The best way to spread awareness on a matter such as neonatal abstinence syndrome is to educate people. I hope you were thoroughly informed on what NAS is, how it affects newborns, and the treatment options available. Thank you for your time.